Welcome to Rejuvalife Institute of Beverly Hills. Today's topic, Lipo Sculpture. So for those of you who work out regularly, who have got a regimented diet, but have not achieved the goals you're looking for physically, we hope today's subject will give you the answers you need. Dr. Berger, what is the difference between Lipo Sculpture and liposuction?
Well, CC, Lipo Sculpture is something that is new, and it's about contouring and shaping the body. Liposuction is kind of a traditional method that's used to get rid of excess fat for people that are more obese, and it's more related to losing a lot of weight. So when you're interested in losing a lot of weight, you think more of liposuction. That's a little more of a involved procedure. Should be done probably in a operating theater. But lipo sculpture can be done in the office safely without the need for general anesthesia, and is used to just contour the body, sculpt the body to bring back those really nice lines and get rid of the stubborn fat.
Dr. Berger, how much fat can a person intelligently or logically have removed, and is there specific areas that you focus on, or are there areas you try to avoid?
Well, Cece, we can take out 2 to 3 liters of fat in every session, and this would be the equivalent of 2 to 3 large Coke bottles of fat. And the areas that are most popular include the upper abdomen, the lower abdomen, the love handles or the flanks, the lower part of the back, the hips, the bra bulges, the upper and lower bra bulges that can develop, the saddlebags, the inner thighs, the knees, that's the front and the inner part of the knees that bulge, and then other areas could also include the upper arms that can hang out and be very prominent. So these are the most common areas that we will treat.
Dr. Berger, liposculpture, how is that procedure done?
Well, Cece, the beauty of liposculpture is that you don't need any general anesthesia or IV sedation. Patient will come in, we'll get them relaxed by giving them some oral medicine, and then we will put them on the table that we're going to do the procedure on and clean them up, and then we'll get them ready for the procedure by doing some really amazing local tumescent anesthesia. This is really the secret of how we can do this procedure in the office and not require any recovery. So this is a fluid that we put in the procedure room that will basically soften the fat tissue and numb up the area, so that when I'm actually taking out the fat, the patient isn't going to feel anything. They're going to be completely painless and very comfortable. Once the fluid's in, then I can use the cannulas to suck out some of the fat, some of the deeper fat, and debulk the tissue. And then I can use the laser to finish off the job, to smooth the skin out and to tighten the skin to give the patient an ideal result. After I'm done with that, then we just clean the patient up, wrap them up in a tight compression garment, and they can basically just leave immediately, walk out without requiring any recovery. And that's how it's done.
Dr. Berger, are there any risks as far as scarring? Is that a possibility?
Well, Cece, the great thing about this procedure is that the incisions are so small they don't even require any stitches. And it's amazing to see how these little holes can just heal up and patients will not even see a mark. Of course, you know, small scars can occur, but with these kind of holes, they're almost imperceptible usually, or very, very tiny, and probably the most aesthetically pleasing kind of results that you could get. So it's really very, very nice, and both the patients and I are very happy.
Dr. Berger, is liposculpture, is it reasonable for everybody? Is it expensive? What can a person expect when they come in to pay a cost for this?
Well, CC, this is a very reasonable procedure because you're not paying the cost of general anesthesia, you're not paying the cost of an operating room, and you're not paying the cost of, you know, a lot of downtime, which, you know, you're basically going to lose time from earning a living and making money. So from that perspective, it's very reasonable. Generally, you know, it goes by the area, and you can expect that, you know, one area to do, the first area is going to cost you somewhere between, let's say, $2,000 to $3,000, and every additional area is going to cost you somewhere in the range of a couple of $1,000s. And so it really just depends on how many areas you're going to do. It's very cost effective, and the nice thing about it is it's permanent. And the last thing that we offer patients is some ability to get no interest credit, so they can basically pay this off without paying any interest for up to a year or so. So that's very desirable for a lot of patients.
Thank you for joining us today at Rejuvalife Vitality Institute. Today's topic was Lipo Sculpture. We hope this will help you with your answers regarding Lipo Sculpture. I'm CC Perkinson, reporting for CC Variety TV.